In this presentation, we're going to be talking about gastric ulcer, and this is by a man, Damie and Marie. Case study. John Smith, a 45-year-old man who was a widow and a smoker, was having severe burning pains in his stomach. He always felt nauseated, often felt bloated, and experienced a sudden loss of weight. The pain worsened when he had an empty stomach. However, the pain would subside after eating. The cause of his illness was unknown, but after time the pain became intolerable and John became nauseated and he threw up. John decided to see a doctor because he noticed he had blood in his vomit. The doctor spoke to John about his pain and they continued to keep him under observation. The doctor observed that John had pains around his upper abdomen below his chest area. John was given acetaminophen to help stabilize the pain temporarily and was admitted to the emergency room due to internal bleeding from his small intestine. The medical staff decided to operate on John, and John was kept sedated, and the doctors did the best to tie the bleeding blood vessels. After surgery, John was given medications and a diet regime to follow in order to help his healing process. Introduction. What is peptic ulcer? A peptic ulcer is a defect in the upper gastrointestinal mucosa that extends through the muscularis mucosa into the deeper layers of the gut wall. Peptic ulcer disease occurs when the stomach or the first part of the small intestine forms an open sore. Most peptic ulcers are developed when the protective lining of the digestive system is eaten away by bacterial infections. There are two common types of peptic ulcers. We have the gastric ulcer and we have the duodenal ulcer. What is gastric ulcer? A gastric ulcer is also known as a stomach ulcer and it usually develops on the lining of the stomach. And what is duodenal ulcer? Duodenal ulcer is a sore lining of the duodenum. The duodenum is the first component of the small intestine, the section of your digestive system through which food passes immediately after it exits the stomach. In this presentation, we're going to be focusing more about gastric ulcer. Causes of gastric ulcer. The main causes of gastric ulcer is a bacteria called Helicobacter pylori. Helicobacter pylori is a bacterial infection that causes the inflammation of the lining of the stomach, which eventually causes an ulcer. We also have the non-steroidal anti-inflammatory drugs, which is also known as NSAIDs, and this is a known cause for causing an ulcer. NSAIDs, like ibuprofen, inhibits the enzyme called co-oxygenase 1 in the gastrointestinal tract, which are responsible for the synthesis of inflammatory prostaglandins. NSAIDs decreases the concentration of prostaglandins for an extended period of time, which has an effect in the gastric mucosa, and they eventually become highly susceptible to mucosal injury. NSAIDs are associated with gastrointestinal toxicity and have important consequences for the healthcare system. They have a strong effectiveness and long history of therapeutic applications, but they may induce ulcer and could have a fatal complication. We also have excessive stomach acidity or hyperacidity. According to pathophysiology texts for health professionals, impaired mucosal defense seems to be a more common condition in gastric ulcer development, whereas increased acid secretion is the predominant factor in duodenal ulcer. The less common causes of gastric ulcer are known as smoking and the consumption of alcohol.
Normal anatomy of the stomach. Cardia is the first portion of the stomach just below the esophagus. It is made up of cardia sphincter. Cardia comprises mostly of the valvular cells that secrete mucus. Mucus is predominantly made up of glycoproteins and water. The rounded region is the fundus. It lies to the left of the cardia and below the diaphragm. The fundus in the body are mainly parietal cells that secrete hydrochloric acid and the key cells that secrete pepsinogen, which is an enzyme that digests protein. The third part is the body. It is the largest main part of the stomach. It is where the food breakdown happens. The fourth section of the stomach is pyloric antrum. The antrum retains the broken down food until it is ready to be released into the small intestine. This part is also the exit of the stomach into the duodenum. The superficial portion of the gastric mucosa exists in the form of a gel layer which is impermeable to acid and pepsin. The last part would be the pylorus. It is the part of the stomach connecting to the small intestine and composed of pyloric sphincter, a thick ring of muscle that acts as a valve to control the emptying of stomach contents into the duodenum. The pyloric sphincter prevents the contents of the duodenum from going back into the stomach. Layers of the stomach wall. The stomach is made up of several layers of tissue. The mucous membrane, also known as the mucosa, is the stomach inner lining. The mucosa has a coarse texture when the stomach is empty. These ridges flatten out when the stomach fills with food. The next layer below the mucosa is the submucosa. It consists of connective tissue and a larger blood and lymph vessels, nerve cells, and fibers. The third layer is a muscularis propria or muscularis externa. It is the main muscle of the stomach and it is made up of 3 layers of muscle. The serosa is the fibrous membrane covering the outside of the stomach. It is also called the visceral peritoneum.
Signs and symptoms of gastric ulcer. If you have a gastric ulcer, you might experience epigastric burning or pain. This might come and go and is relieved by eating or taking an antacid. Indigestion is common. You feel very full and bloated after a meal. You can experience nausea, feeling like vomiting. There is a change in appetite as well. If severe, you have a sharp pain in your stomach that doesn't go away. Vomit or stools that are dark or black in color are common. Disease affecting the normal anatomy. Ulcers typically appear as single small round cavities with smooth margins that make a hole in the submucosa. It forms when the thick layer of mucus that defends the stomach from digestive juice is eroded away. The main cause of stomach ulcer is the Helicobacter pylori bacteria. These are the gram-negative rod bacteria that colonize the gastric mucosa and bind it, and then cause inflammation. This generally begins in the antrum and then spread to the rest of the stomach and eventually into the duodenum. This can cause this protective mucosa lining to break down. This breakdown becomes a problem because our stomach contains strong acid which is intended to digest food. Without the mucus layer to protect it, the acid can eat deeper into the stomach tissue causing ulcers. Diagnosis and treatments. Urea breath test is used to identify the H. pylori bacteria infection. If the ulcer is caused by the bacteria, the usual treatment is triple therapy. This involves taking 2 antibiotics to kill the bacteria and a medicine to reduce the amount of acid made by your stomach. If you don't have the bacterial infection and you have been using anti-inflammatory drugs, then you will need to stop taking them. You need to start taking a drug to reduce acid production by the stomach. Taking antacids, drinking less alcohol, and quitting smoking can help.
In summary, peptic ulcer is a breakdown of the protective lining of the mucosa which penetrates deep into the layers. Helicobacter pylori is a common cause of this ulcer and is followed by NSAIDs. Treatment is primarily medical and surgery is suggested sometimes when the condition of ulcer becomes complicated.